guys, it's me, Professor D, and welcome back to my channel. If you haven't done so already, please be sure to like, comment, and subscribe below. On the video today, I want to cover urinary elimination. So this also, guys, is going to be a two-part series. So I'll cover half of the questions on this video, half on the second. So make sure you guys watch out for the second part. So let's get into it. Number one. The nurse demonstrates that the nursing diagnosis, stress urinary incontinence related to decreased pelvic muscle tone, is the most appropriate for an oriented adult female. A therapeutic nursing intervention based on this diagnosis is to 1. Apply adult diapers, 2. Catheterize the client, 3. Administer urine, or 4. Teach Kegel exercises. And I'll give you a moment to think of your answer. Okay, guys, and the correct answer is 4. Teach Kegel exercises. I want to explain this to you. Let's go back to the nursing diagnosis where it says stress urinary incontinence related to decreased pelvic muscle tone. Okay, so that decreased pelvic muscle tone, right? That is what's causing this urinary stress incontinence. What is urinary stress incontinence? When the patient is incontinent, you know, they have no control over their bladder whenever they're stressed on the bladder, such as coughing, such as sneezing, such as laughing. Okay, that's what stress incontinence is. Why do they have the stress incontinence? Decreased pelvic muscle tone. So how can we increase the pelvic muscle tone? Kegel exercises. That's why for the correct answer, Kegel exercises increases that the pelvic muscle tone. It increases the strength of, what's the word I'm looking for? The word I'm looking for. Your sphincter, your urinary sphincter. Okay, and increases, it strengthens those muscles. So that way, if a patient laughs, they cough, they sneeze, right? But they've been doing those Kegel exercises. What they do is they'll contract those muscles, right? And they'll tighten up that sphincter so that the urine won't leak out of the urine. The urine won't leak out of the bladder. I'm sorry. Okay, guys? So Kegels are wonderful for that, okay? It strengthens those muscles so the patient can kind of clench up and hold on to the urine until an appropriate time that they can get to a restroom. Before we move on to the next question, I want to go over these other choices. 1, apply adult diapers. Applying adult diapers, that'll keep the patient dry, but it does nothing for the problem. What was the problem? By the way, guys, when you have a nursing diagnosis, the problem is what comes after related to. So say ABC related to XYZ. The problem is your XYZ, right? So the number 1, adult diapers does nothing for the problem, which is the decreased pelvic muscle floor. So we get rid of that. Number 2, catheterize the patient. Well, catheterizing the patient, it'll keep the patient dry. It'll keep urine out of the bladder, but it does nothing for the muscle tone. So we're going to get rid of that. 3, administer urine. Well, guess what? Giving the patient urine, that's going to get urine out of the bladder because it increases urination. But it does nothing for the muscle tone. And the question was, what are you going to do for the muscle tone? And so the correct answer is Kegel exercises, okay? Next question. The nurse suspects that the client has a bladder infection based on the client's exhibiting an early sign or symptom, such as 1, chills, 2, hematuria, 3, flank pain, or 4, incontinence. And I'll give you a moment to think of your answer. And the correct answer is hematuria, okay? Now in the question, what they said was an early sign. And hematuria, that's an early sign. Let's go at these of a bladder infection, okay? Let's look at these other choices. 1, chills. Chills, that is a sign of a systemic system. That means that bladder infection got so bad that now it's systemic. Patient could have pyelonephritis, is generalized. So chills, which is a general, a systemic issue, that's not an early sign of a bladder infection. You have choice 3, flank pain. Flank pain, that's a sign of pyelonephritis. So the patient had a bladder infection. Now what happened was the bacteria creeped up from the bladder, creeped up the ureters, and now it's up in the kidney. Now that patient has pyelonephritis. So that's a late sign, okay? And then you have 4, incontinence. Incontinence is not a sign of bladder infection. Bladder infection, patients will have hematuria. They can have dysuria. They can have urinary frequency. They can have urinary urgency, but not incontinence. And incontinence is not a sign of a bladder infection. So an early sign of bladder infection is hematuria. Are you ever supposed to have blood in your urine? Absolutely not. Are you ever supposed to have protein in the urine? Absolutely not. Are you supposed to have dysuria, frequency, urgency, all those other symptoms I told you about? No, those are signs and symptoms of possible bladder infection. Okay. Next question. Immediately after an IV pyelogram, the nurse should observe the client for which of the following? 1, infection in the urinary bladder. 2, an allergic reaction to the contrast material. 3, urinary suppression caused by injury to kidney tissues. Or 4, incontinence as a result of paralysis of the urinary sphincter. And I'll give you a moment to think of your answer. And the correct answer is 2, an allergic reaction to the contrast material. So for this question, guys, you guys had to know that an IV pyelogram uses contrast media. And there's a hint. At the end, it said gram. Usually when something has gram at the end of it, it lets you know that they're using some kind of contrast media. Okay? Patients using contrast media, you'd better make sure and find out, do they have any allergies to iodine? Do they have any allergies to shellfish? Patient that had contrast media is very, 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 very hard on the kidneys, okay? So any patient that's had contrast media, you want to be looking at the BUN and the creatinine and make sure they're not elevating, because if they're elevating, that's letting you know that the kidneys are in trouble. That's why when patients get contrast media, right after, what do they get? A bolus of IV fluid. Why? We're trying to flush out their system. We're trying to help the kidneys by giving them lots of fluids, because contrast media is very hard on the kidneys. So 2 things you got to worry about when a patient gets contrast media. You got to worry about allergies. Do they have any allergies to shellfish? Do they have any allergies to iodine? And you got to worry about their kidneys. Are their kidneys in trouble? Okay, so a way you're going to help them is to make sure they get IV fluids after the contrast media. Next question. A client with an extensive alcohol intake has a reduced amount of antidiuretic hormone. The nurse anticipates the client will exhibit 1, hematuria, 2, an increase in blood pressure, 3, dry mucous membranes, or 4, a low serum sodium level. And I'll give you a moment to think of your answer. And the correct answer is 3, dry mucous membrane. So I want you to think about what's going on here. So let's go back to the question. Client has excessive alcohol intake and they have a decreased amount of ADH. I want you to think about this here. What is ADH? What is anti-diuretic hormone? Okay, diuretics are things that make you urinate, right? So anti-diuretics will be something to make you hold on to all your urine. Okay, it makes you hold on to all your fluids. This patient doesn't have enough of it. So instead of holding on to all their fluids, they're letting all their fluids go. They're urinating all over the place. They're like Oprah. You get urine, you get urine, you get urine, you get urine, right? So if that patient's urinating all over the place, are they going to be full of fluids, or they're letting go of the fluids? They're letting go of their fluids. So what? They're going to have dry mucous membranes. They're going to have those signs and symptoms of dehydration. You do their skin turgor is going to be more than 3 seconds, right? Their lips are going to look chapped. Their eyes may be sunken. Why? Because they're dehydrated. They can have flat flat jugular neck veins, right? They're not going to be distended. They're not going to be full. They're not going to be bounding. They're going to be flat. They may be weak. Why? Because that patient's dehydrated because they lost all of their fluids. So guys, don't forget your signs and symptoms of fluid overload versus fluid deficit. And obviously any patient that has decreased amounts of antidiuretic hormone, they're going to have the signs and symptoms of dehydration, such as dry mucous membranes. Why? Because instead of holding on to their fluids, they're letting it all go. So these questions can be tricky, guys. So you really have to think about what's going on. You have to say to yourself, okay, antidiuretic, what does that do? Antidiuretics makes me hold on to all of my fluids. And if I don't have enough of it, what happens? The opposite, I let go of all my fluids. So don't be so quick to answer a question. You have to think about physiologically what's happening in that patient's body, okay? Next question. The unit manager is evaluating the care of a new nursing staff member. Which of the following is an appropriate technique for the nurse to implement in order to obtain a clean, voided urine specimen? 1. Apply sterile gloves for the procedure. 2. Restrict fluids before the specimen collection. 3. Place the specimen in a clean urinalysis container. Or 4. Collect the specimen after the initial stream of urine has passed. And I'll give you a moment to think of your answer. And the correct answer is 4. Collect the specimen after the initial stream of urine has passed. So guys, this clean voided urine, that's the same thing as a clean catch. Okay, so the clean catch urine, that's urine that we want to get, and we want to get it and make sure that it came from the patient's bladder and not their urinary meatus, okay? So if there's any bacteria in the urine, we know that that bacteria came from their bladder and not from the vagina or not from the tip of the penis. So what you do is you have the patient urinate a little bit. They're going to urinate into the toilet. Then midstream, you put that container, sterile container, because remember, if it's not sterile, there's going to be bacteria in it. And now we don't know if the bacteria came from the container or if it came from the patient. So it's going to be a sterile container. The patient's going to urinate a little bit so that bacteria, everything that was on the tip of the penis or in the vagina, is going to go into the toilet. Then you're going to put the sterile container, catch the urine that we know is now coming from the bladder, and we're going to test that. That's your clean catch. So let's look at our other choices. 1, apply sterile gloves for the procedure. You don't have to apply sterile gloves. You don't need sterile gloves. You just need clean gloves, because this is not something invasive, right? But what does need to be sterile is the container you're using. So 1, apply sterile gloves. No. 2, restrict fluids before the specimen collection. You're not going to do that. And let me explain to you why. If you restrict fluids, that patient's urine is going to be concentrated. And we don't want that. So we're not going to restrict fluids. 3, place the specimen in a clean urinalysis container. No, that specimen is going to be in a sterile container so that we make sure if we find any bacteria in the urine, we know that bacteria came from that patient's bladder and not from anywhere else. And that's why number 4 is the correct answer. Next question. The nurse is aware that clients with chronic alterations in kidney function suffer from insufficient amounts of 1, vitamin A, 2, vitamin D, 3, vitamin E, 4, vitamin K. And the correct answer is number 2, vitamin D. So guys, remember, the kidneys are responsible for converting vitamin D into its activated form. So the kidneys don't make vitamin D. It doesn't make vitamin D, but it converts vitamin D into the active form that we can actually use, okay? I want you guys to look at the other choices. 1, vitamin A. Vitamin A is good for lots of things, including vision, right? Carrots, full of what? Vitamin A. That's why we tell patients to eat lots of carrots, good for the vision. Vitamin E, that's an antioxidant. It's good for immunity. And then you have vitamin K. You guys know what vitamin K is. Vitamin K, Coumadin, right? Vitamin K is the antidote for Coumadin. Don't forget that. That's very important. But for this particular question, when they're asking about kidneys, if the kidneys are in trouble, something you'll also see is a decrease in the number of vitamin K. Why? Because vitamin K, I'm sorry, and vitamin D. Why? Because we know the kidneys are responsible for converting that vitamin D from its inactive form to the active form that we can use. Next question. The nurse is caring for a client who's receiving closed catheter irrigation in those 950 mLs, a normal saline irrigant during the shift. There's a total of 1725 mLs in the drainage bag. The nurse calculates the client's urinary output for the shift to be 1, 775 mLs, 2, 950 mLs, 3, 1725 mLs, or 4, 2675 mLs. And I'll give you a moment to think of your answer. And the correct answer is 1, 775. How did we get this? So guys, the urine output, the total was 1725, right? But don't forget, we use 950 to irrigate. Okay? That 950 came from you, the nurse, and you use that to irrigate. So you can't count that as part of the output. You're the one who put it there when you were irrigating. So you're going to take the total output that patient has, and you have to subtract what you, the nurse, put in there for irrigation. And so when you do the 1725 minus the 950, that's how you end up with your 775. Next question. The client is experiencing urinary retention and the healthcare provider is contacted. The nurse anticipates a medication that will be ordered to promote emptying of the bladder. 1, ditropan. 2, uricoline. 3, probanthine. Or 4, mycostatin. And I'll give you a moment to think of your answer. And the correct answer, guys, is 2, uricoline. Why? What does uricoline do, guys? Remember, it increases the contraction of the bladder. I want you, well, before I tell you what I was going to say to you, let's look at our other choices. You have 1, ditropan. Ditropan's an anticholinergic. Okay, so what do those do? Ditropan, it'll decrease the incontinence. 3, probanthine, another, that's an anticholinergic. Same thing, it decreases the incontinence. I'm going to explain that to you in a second. Then you have 4, mycostatin, which is an antifungal. Let's go back to the question. So the client's experiencing urinary retention, so they're holding on to the urine instead of letting it go, okay? They're experiencing urinary retention and the doctor's contacted. The nurse expects what medication to be ordered to help empty the bladder. So that's why number 2 is the answer. Uricoline, remember what I told you? It increases contraction of what? The bladder. So the muscles of the bladder starts to contracting. They start squeezing, and the urine comes out, right? Choices 1 and 3, both of those are anticholinergics. What do anticholinergics do? They dry everything up. Okay, remember that, well, those of you guys who were my students, remember the poem I taught you about the anticholinergics. Anticholinergics can't see, can't spit, can't pee, can't, right? Why? Because it dries everything up. So if you guys ever get a question about anticholinergics, now you know. But for this particular question, when they're asking about emptying of the bladder, no, you want a cholinergic. What does a cholinergic do? It increases the bladder contraction. Once that bladder starts contracting, it gets rid of all the urine that's sitting inside of the bladder. Next question. Urinary elimination may be altered with different pathophysiologic conditions. For the client with diabetes mellitus, The nurse anticipates that initial urinary sign or symptom will be 1, urgency, 2, dysuria, 3, hematuria, or 4, polyuria. And I'll give you a moment to think of your answer. The correct answer is 4, polyuria. If you guys recall, a couple questions ago, I was going over those early signs and symptoms of a bladder infection, and I told you about the hematuria, the dysuria, the urgency. 1, 2, 3, those choices 1, 2, and 3, those are the initial signs of a bladder infection for your normal layperson, not for your diabetic. For your diabetic, one of the initial signs that you'll see of a urinary infection is going to be polyuria, where they keep having to urinate. Okay, and I explained this in my diabetes video already, so if you haven't seen it, make sure you guys watch it. But I went into detail ad nauseum about why this happens. But for that diabetic patient, you're going to see the polyuria. But for your normal layperson who is not diabetic, you're going to see those other normal signs and symptoms, such as the hematuria, the urgency, the dysuria, the pain. Okay? Next question. The nurse is assessing a client admitted with complaints related to chronic kidney dysfunction. The nurse recognizes that this client is most likely to present with which of the resulting symptoms? A, anemia. 2, let's just say A, I'm sorry, 1 anemia. 2, hypotension. 3, diabetes mellitus, or 4, clinical depression. I'll give you a moment to think of your answer. Okay, guys, the correct answer is 1. When a patient has chronic kidney disease, which means that kidneys have been in trouble for a long time, what would we expect to see? Anemia. And here's why. Along with the kidneys being responsible for the activation of vitamin D, which I just talked to you guys about, kidneys also responsible for erythropoietin. Now, erythropoietin, that's what helps the bone marrow to produce RBCs, okay? We know that red blood cells are produced where? In the blood marrow, okay? But what stimulates them to start being produced? The kidney's responsible for the erythropoietin, which stimulates those little baby RBCs to be produced in the bone marrow. So when you see the kidneys are in trouble, the kidney function go down, erythropoietin goes down. Erythropoietin goes down, guess what? RBCs are going to go down. If RBCs go down, hemoglobin goes down. And if patient's hemoglobin's down, they're what? Anemic. Okay, so it's kind of like a domino effect. Which of the following statements made by a client experiencing chronic kidney dysfunction reflects the best understanding of the most common physiologic effects this disorder can have on the body? 1, I'm tested regularly for anemia. 2, my diet is restricted because of this problem. 3, diabetes runs in my family, so I get tested regularly. Or 4, I can get really depressed if I think about this too much. And the correct answer is 1, I get tested regularly for anemia. Once again, if the kidney's in trouble, so's erythropoietin production. Erythropoietin production is in trouble, so is RBC production in the bone marrow. RBC production in the bone marrow goes down, hemoglobin goes down. Hemoglobin goes down, patient's anemic. There you go. So that's why number 1 is the correct answer. Which of the following clients will most benefit from client-parent education regarding the prevention of renal infections via proper hygiene habits? 1, males ages 35 to 65. 2, males age 3 to 16. 3, females age 3 to 12. 4, females age 20 to 50. And I'll give you a moment to think of your answer. Okay, guys, so before I tell you what the answer is, I hope that you automatically got rid of number 1 and 2, because the patients who are most at risk for UTIs are females. Why? They have shorter urethras, okay? So that leaves us with choices 3 and 4. And the correct answer is 3, because females aged 3 to 12 are going to have a shorter urethra than females aged 20 to 50. But guess what? Females aged 20 to 50 still have a shorter urethra than any males. But I digress. So females aged 3 to 12, they have shorter urethras. And on top of that, especially those the young toddlers, the preschool age females, right? They're still learning to clean themselves. So they're not really wiping front to back like they're supposed to. And so what happens, they'll wipe back to front, or they don't wipe themselves well, and they're running around. So the feces that was on the lining of the underwear now scoots up to the vagina, and before you know it, you got E. coli and all types of other bacteria climbing up the vagina, up the urethra, and into the bladder. Okay, so those are 2 of the biggest reasons that you're more likely to see UTIs in that particular population. Okay. The nurse is interviewing a client with a history of benign prostatic hypertrophy, BPH. In light of this diagnosis, the nurse should include information regarding which of the following in order to assess the chronic effects of this renal disorder. 1, number of times he usually urinates within 24-hour period. 2, what medications he's currently taking for the condition. 3, the result of his latest PSA testing. Or 4, whether he usually experiences a complete emptying of his bladder. And I'll give you a moment to think of your answer. And the correct answer is 4. If the nurse wants to assess the chronic effects of this disorder, you're going to find out about 4, whether he or she experiences complete emptying of the bladder. So first of all, guys, you know that the prostate, only males have prostates, right? And the thing is, the prostate, it encircles the neck of the bladder, okay? It encircles the neck. So what happens is, let's just pretend for a moment. I'll take this. Let's pretend for a moment that my dry erase cleaner, okay? This tube is the urethra, okay? And this circle, my fingers formed a circle around this tube, is the prostate, okay? My fingers that are encircling this tube is the prostate. And the prostate forms a circle. It hugs the neck of the bladder, just like this urethra, okay? The neck of the bladder. So here's what happens. When a patient has BPH, okay, the prostate that hugs the neck squeezes that neck. It squeezes and squeezes and squeezes and squeezes and squeezes. So guess what, guys? If you have a prostate that's squeezing the neck of your bladder, are you going to be able to get any urine out? No, you're not, because it's squeezing the neck. You're not going to be able to get anything out. If the patient is able to get something out, it's what? They're dribbling. It's in tiny little dribbles. So they're never able to empty their bladder. They'll feel like they have to urinate. They get to the bathroom and they're trying to squeeze the urine out but they got this prostate that's squeezing the neck of their bladder. They're only able to get a couple mLs out, and then they always feel like they have a full bladder. Why? Because of that prostate. Okay? So choice number 4, asking whether he usually experiences a complete emptying of his bladder. So guess what? If that prostate's gotten better, it's not squeezing the neck of the bladder. They're going to feel like they're able to empty their bladder normally. I hope that demonstration helped. If not, I'm sorry. I should have prepared better and had a better visual aid for you next time. Okay, one more question. Last question. The nurse is discussing signs and symptoms of both upper and lower urinary tract infections with a client who has a history of both. Which of the following statements by the client reflects the best understanding of the differing symptomology? 1, when I get cloudy urine, I figure I have an infection. 2, burning when I urinate is usually the first symptom I notice. 3, I have a big problem when I feel like I have the flu, but with back pain too. 4, when I see blood in my urine, I know I need to call the healthcare provider, and I'll give you a moment to think of your answer. Okay, guys, and the correct answer is 3. What this question is really asking us is, which patient knows the difference between a lower and an upper urinary tract infection? Okay, and so 3 is the answer. I have a big problem when I feel like I have the flu, but with back pain too. Why? Because normal lower urinary tract infections, bladder infections, right? Cystitis. Patient will have urgency, dysuria, hematuria, right? But when that turns into something generalized, it turns into something systemic, such as pyelonephritis, right? They start having systemic issues, body aches, body pain. That's why they kind of feel like they have like the flu. They have malaise. Those are systemic issues. Those are systemic symptoms. It's not localized, right? Those are generalized. They have body aches. They have malaise. Back pain. Why back pain? You know where your kidneys are located? If you take your 2 hands, put it behind your back like this, if you guys can see. So you put your 2 hands behind your back. Where your palms are touching, those are where your 2 kidneys are. Okay? So that back pain is from that bacteria that floated up from the bladder and it's gone creep all the way up the ureters and now have gone up to the kidneys, and now that patient has pyelonephritis. So that patient knows they're in big, big trouble if they've gone from just a normal urinary tract infection to these systemic symptoms such as the malaise, fever, back pain, muscle aches. All of those are systemic symptoms, and that lets you know that patient's in big, big trouble. Guys, I hope these questions were very helpful to you. I promise I'm going to make a part 2 video to complete these questions, but I'm trying my best to keep my videos under 30 minutes. I was not successful this video. Hopefully I will be next time. Guys, once again, please do not forget to like, comment, and subscribe below, and I'll see you next time.